Hi, Steve Adler. Good evening. You got a minute? We're going to go over the virus numbers, and they're changing and they're moving up. And maybe you can help me think through what we need to be talking about or doing as a city, how we can get a city to take control of something that, quite frankly, other cities haven't demonstrated an ability to do either. But the numbers are concerning tonight, and we're going to look at those. We'll touch base talking about vaccines that are now available for the flu, not for COVID yet, but we're going to use them as a dry run for getting the COVID virus out. And then I'm going to touch base on what's been happening with the Task Force on Institutional Racism and Systemic Inequities, because it's going through the next chapter of its life. Let's begin with the numbers. So we're at the two main dashboards that we have. We take a look at the number of new hospitalizations and look at that number. It is 31 new admissions into the hospital. That is significantly above the 7-day moving average, which at this point is now 22. Remember, we had gotten down to 12. We were pushing to get to below 10, because if we got below 10, we could start opening things up even more. We weren't able to get to below 12. We're up at 22, but today's number is 31. When we were looking at the UT model, that's what it predicted based on where we were. 69 new cases, lower number of cases in our community, 7-day moving average of 90. But yet our hospitalizations are going up. We're trying to get a handle on that, see exactly who those people are and why they're ending up in the hospitals like this. But where our system starts failing is if we get too many people in the intensive care units. People that get sick go to the hospital. Those numbers go up. It gives us a trigger for telling us when ICUs will start going up. And remember, there's a lag time. Anything we do today is not going to change numbers for another couple of weeks. 31 new hospitalizations. You know, I read, not completely, but I read the comments sometimes on these, and I know people don't want to restrict lives. People are upset with the restrictions that we have in place. But I'm going to be fighting really hard to keep our schools open. I'm going to fight really hard to keep businesses open. We're going to have to figure out how to do this and keep the numbers down. And if we just pretend like if we don't do anything, the numbers will stay down or our hospitals won't get overrun, we're kidding ourselves. This is not political. It's not partisan. It is just math. It's just the numbers. All right, look at the numbers in the middle, those green numbers down at the bottom center. 107, 7-day moving average, people hospitalized. 40 is the 7-day running average for ICUs. And 23 is the 7-day running average with ventilators. Let's see how we're doing. 7-day number, hospitalizations, 107. In our hospital tonight, 133. See how fast these numbers, when they start going up, they go up quickly. 7-day moving average hospitalizations, 107. We have 133 tonight. ICUs will lag behind that. The 7-day moving average is 40. We have 46 people in the ICUs. Remember, that was the number when it got over 100. We started having our hospitals having significant problems. We were looking at getting up to 200. And at that point, we have doctors that are on the news and the media pleading with the community to save our capacity. Number of ventilators, 7-day moving average is 23. Those are the number of people we have on ventilators tonight. Each of those are lagging indicators. Each one of them is a successive lagging indicator. I'll take suggestions. I don't know how to engage a community in making sure that we're more religious about wearing masks. And it's not just masks when you go to restaurants or stores. People seem to be doing that well. What we're hearing is that people are gathering in the evenings with their friends. You don't put on a mask with your friends because it's your friend. What are the chances? Their friend's not going to carry the virus. Except your friends do carry the virus. Sometimes they don't even know that they're carrying the virus. It's really important that if we're going to be within 6 feet of people that are not in our home, that you wear the masks. We should be limiting the number of people that we're around so as to limit the opportunity for the infection. At some point, Dr. Escott is going to have to start considering closing schools. He's going to have to consider putting more limitations on businesses. Heaven forbid, he would have to take a look at whether we start moving back to more, lockdown kinds of behaviors. Boston, Massachusetts, closed in-person schools. We don't want to do that, but I'm at a loss as how to get this discipline through the community at the level that's necessary. So I'll take suggestions. Those are the numbers that we have in the virus. I do want to point out to you that we need to be taking the flu vaccine. I know a lot of people don't take flu vaccine, but you should do that, especially this year. Our ICUs filled up last year just on influenza patients. We can't put ourselves in the position where we have both flu patients and COVID patients. Everybody's waiting for the vaccine for COVID. You don't have to wait. You can get a flu vaccine. You can get an appointment at pharmacies all over town. If you don't have insurance, you can get a flu shot from Austin Public Health. And Austin Public Health is having a walk-up flu shot event on Saturday, October 24th. That's this Saturday at 8 a.m. to 12 p.m. at the Southeast Branch Library. It's a walk-up. They're going to distribute about 200 flu shots, first come, first served basis, with a priority for those people that are uninsured. The October 24th event on Saturday is going to be the first of two. The second event is going to be on November 7th from 9 a.m. to 2 p.m. at the Travis County Expo Center. Appointments are encouraged for the November 7th event, as a very limited number of drive-ups are going to be available. So to schedule an appointment on November 7th, you can call Austin Public Health, their immunization line at 512-972-5520. That's 512-972-5520. You can call Monday through Friday from 8 a.m. to 4:30 to schedule an appointment on November 7th. This Saturday, October 24th at the Southeast Branch Library, you don't need an appointment. You can just walk up, but they only have 200 desks, so make sure you're there early. Opens up at 8 a.m. Both events are serving as a practice for us to distribute a future COVID-19 vaccine. So get a flu shot and participate in helping us see where the bugs might be in the system so we can set up that system. We're getting prepared to start giving people the COVID-19 vaccination probably early next year, early calendar year, which seems to be the earliest that the vaccine for COVID will be getting to us. First people to get it are going to be the people most vulnerable, most susceptible, the frontline healthcare workers. And then over time, more and more people will get it, starting with older people, probably working our way down to kids. But all those protocols are being worked out now. I want to conclude by doing a quick discussion about the Central Texas Collective for Racial Equity. So tomorrow, everybody's invited to attend a program. It's called Building Beloved Community Together, yesterday, today, and tomorrow. It's an event to launch a new nonprofit called the Central Texas Collective for Racial Equality. The Central Texas Collective for Racial Equality is the outgrowth of the Mayor's Task Force on Institutional Racism and Systemic Inequities. I convened that in 2017, modeled on the policing work that President Obama had done. If you recall, we had just had the shooting of David Joseph, 17-year-old child running down the street, absolutely naked, ended up getting shot by the police. He was killed. It was just one more of way too many kinds of incidents that end that way. And I suggested that we take a look at, that we that we do more than just have yet another meaningful conversation, that we actually take a look at systemic changes we could make. But I said, let's not just take a look at policing or criminal justice. Let's look at the same kind of systemic inequities that exist in access to capital, in housing, in healthcare, in all aspects of our lives. They form different groups in education, health, civil and criminal justice, access to capital, real estate, and housing. Each of those groups working under an umbrella that was led by Dr. Colette Pierce Burnett and Dr. Cruz, she the president of Houston Tillotson, he the superintendent then of AISD. Phenomenal leadership. They led groups in each one of those silos I talked about a second ago. They came up with hundreds of really specific recommendations. A lot of work have been done on those specific recommendations. A lot of them have been implemented. A lot of people who participated in that participated in two-day race training classes, seminars with people. One of the most valuable and instructive and worthwhile 2 days I've spent in my life. And more people are doing that, leaders and connectors across the city. If you're interested, something that you ought to do too. But anyhow, in order to keep that initiative and that program and that work going, they're now launching the Central Texas Collective for Racial Equity. Tune in tomorrow at 11:30 to learn more. It's a nonprofit. They have a fund with the Austin Community Foundation. Diane and I have given to it. We're invested in that work and want to see it do well. Tune in tomorrow if you're able to do that. I'm going to close today by talking about voting. Less than 2 weeks to the election now. Open every day in October through October 30th. Election day itself is on the 3rd of November. Don't wait till then. That's the last possible day to vote. It's looking right now that maybe 45% of everybody that's going to vote in this election in our city may have already voted. You should vote too. Join that early momentum to participate in this election. It's crucially important. Vote for president, work your all the way down to the bottom of the ballot. Make sure you vote on Prop A and Prop B to bring some transportation equity to the city. With that, you all have a good night. Take care. And we take Thursdays off, so I'll